Good afternoon. The time is 4:03 p.m. Before we start, we're deeply saddened by the tragic UPS plane crash and extend our heartfelt condolences to all those affected. Our thoughts and prayers are with the families and loved ones impacted by this devastating event. We also want to express our sincere gratitude to the first responders and emergency personnel for their swift and courageous efforts during this difficult time. At this moment, I'd like for you to bow your heads in a moment of silence with us, please. Thank you. This is the regularly scheduled meeting of the Public Safety Committee. I'm your chair, Councilman Dan Syme, and I'll be joined by Vice Chair Councilwoman Tammy Hawkins soon. Today we have the following committee members in attendance: Dr. Barbara Shanklin, Committee Member Ken Herndon, Committee Member Anthony Piagentini, Committee Member Betsy Rui, Committee Member Jenny Mulvey-Woolridge. My Vice Chair Tammy Hawkins has just entered, and we also have J.P. Leninger in the room, and Jonathan Joseph is with us. And we also have been joined by Councilman Winkler. And we also are joined by Ken Hudson. Who else? Jeff Hudson, not Ken. I've done it again. Jeff Hudson. And I think that's it. Please note.
Mr. Chair, I'm online. Councilwoman Parrish Wright. I've been online.
We do have Councilwoman Parrish Wright online. I'm sorry, Councilwoman. Please note, we discuss items number 2 and number 3 and 4 following the special discussion. We have a full agenda today, so I would request that guests keep their opening comments brief. Committee members, please limit yourself to 2 questions at a time before rejoining the queue. Today, we're joined by Directors Josh Crawford and Misty Wright for a discussion on group violence intervention and community safety. Ms. Wright, Mr. Crawford, could you please step up? Yes. Mr. Clerk, would you please read the virtual language?
This meeting is being held pursuant to KRS 61.826 and Council Rule 5A, read in full.
Thank you, Mr. Clerk. Ms. Wright and Mr. Crawford, would you state your name and title for the record and begin, please?
Joshua Crawford, I am the Director of Group Violence Intervention.
And Misty Wright. Misty Wright, I'm the Mayor's Executive Director of Community Safety. And Councilman, it was our intention to allow Mr. Crawford to speak about GVI and answer your questions about GVI because he is the director. And then I have some additional things to update this committee about, but I'm happy to stay here for the duration of his testimony if that would be helpful.
Well, we are going to be on a hard stop. We've got 10 minutes to present, and we're going to give the council 20 minutes for questions and comments. So begin now. We've got 10 minutes.
Well, thank you very much, Mr. Chairman, Madam Vice Chair, members of the committee for having me here today. Before I begin, I want to thank this committee and its members for the recent resolution related to the expedition of the juvenile detention facility. There are no magic solutions to the problem of crime and violence in this city, but the operation of a downtown Louisville juvenile detention and service center can serve as a key part of that component in making this city safer. So as has already been stated, I am the Director of Group Violence Intervention. I have been in that role for approximately 10 weeks. I'd like to update you all on where we are on a number of metrics year to date and where we think we're going from here, but most robustly, I want to answer whatever questions you may have for how we are operating and how we will be operating going forward. As you all know, our primary mechanism of reaching those driving violence in our city is a mechanism called custom notifications. Year to date, we have done 74 of those. 45 of those were of adults. 29 of those were with juveniles. Part of the custom notification process is the unconditional offer of services to those individuals should they choose to take them up. 35 of our adult custom notification individuals have expressed interest in the uptake of those services. 22 of our juvenile custom notification individuals have expressed interest in those services. Part of what we do with GVI is for those who are most at risk of violent victimization in our city who are GVI participants. We do offer some relocation services outside of the city. We do not relocate within Jefferson County, and we relocate a minimum of 2 hours away from the city of Louisville. So far, we have engaged in 8 of those, with 2 of them in process. Metro Council allocated a line item of $20,000 specific for those relocations. Through those 8 relocations, we have currently spent $43,000. I have reallocated some money from our general operating budget to assist with those relocations, and we have a robust partnership with Joshua Community Connectors and Ms. Kimberly Moore, and they weighed into that as well on our behalf. We are in the process of some new and expanding partnerships with agencies both within Metro government and outside Metro government. That custom notification process, when we go out to talk to an individual and engage them and deliver that 3-pronged message of nonviolence that includes that unconditional offer of services, that includes the threat of a swift law enforcement response if violence continues, and that includes a community moral voice that expresses a dissatisfaction with the status quo of violence in the city. To do that most effectively, we're always looking for new partners to bring into the fold. One of those partners that I am most excited about is an upcoming partnership with the ACE Project. For those of you that don't know, the ACE Project is a group of moms who have been personally affected by violence in our city. And when you look at other cities that use the GVI model, that use the focused deterrence model most effectively, oftentimes the most effective communicators of that community moral voice are individuals who have been personally affected by violence, most acutely moms who that violence has come to their front door and impacted their home. We're also expanding our partnership with Goodwill to offer more employment-based services to GVI participants, and we're in the process of building out a partnership with the Louisville Metro Department of Public Health to offer more behavioral health services to GVI participants. Finally, we are increasing the referral process to GVI for juveniles. Juvenile violence is something that is very much on the mind of Louisvillians. While juveniles do not make up the majority of offenders in this city statistically, as we have seen crime and violence decline in recent years, we have seen the share of that perpetuated by juveniles or perpetuated against juveniles increase. And so juveniles get special attention from us at GVI, and we get referrals from JCPS, DJJ, and the like. And finally, as many of you know, Detective Ivan Haygood has been the tip of the spear for GVI in the city of Louisville for a number of years now. And despite what many of you may have heard, and despite what he is able to do, he is in fact only one man. And so Detective Haygood is leading an effort to do a patrol division pilot project where we will bring GVI to the patrol divisions, partnering with hand-selected officers in those divisions to expand our reach and to interact with more people in a more direct way.
And Councilman, if I may, I'll speak for about a minute just with the most important updates that are not necessarily related to GVI. I spoke with you guys a few months back about Safe Louisville and the Mayor's Crime Reduction Plan. There were some questions that came up, and OVP spoke with you at your last meeting about CBI, among some other things. I just want to follow up with that. So we talked about last time how the CBI sites here had a 62% reduction in gun violence, but now that that baseline data has been established, those sites are expanding and they are moving. That decision is being made right now, and the contours of that is being determined right now. But you're going to see, with the exception of Newburgh, which is structured with a federal grant. You are going to see changes that expand Russell both west and east, covering Elliott Park and then going east to 18th. You're going to see Algonquin Park Hill to be expanded across Dixie Highway. You're going to see Taylor Berry move almost entirely due to reduced violence in the area to move south. So it's going to be at the north end of the Jacobs and Wyandotte neighborhoods. So basically Manslick to Fifth and Berry to Beecher. And that is ensuring that all parks are covered. Also, earlier this month, on the 21st, or last month now, on the 21st of October, the California site started operating. So we have violence interrupters, interventionists at that site operating right now. That's 26th to 15th and Broadway to Hale, excluding the industrial area that's near Northwest California. And Outreach will continue to operate as a mobile CVI site. So Outreach can go anywhere in the city upon any referral from any source to provide those same services. The park rangers have also now become active, and in the couple of weeks that Chief James Brown has been active, we've already seen 20 arrests, 24 citations. And we are also seeing some significant improvement in our critical infrastructure. So as you know, the mayor established the task force for critical infrastructure in response to some copper thefts that were affecting highway lighting. And we've gotten a report from AT&T that we were number 3 on their list across the nation in terms of loss, like right behind Houston and LA. And in a matter of months, we moved down to number 37, and we're now being used as a model by AT&T for other cities to work together, state, local, and private entities to reduce copper theft. So with that, Councilman, I want to make sure that I don't speak over my time and answer any questions.
Thank you, Ms. Wright. We do have some folks in the queue, and first off would be Councilwoman Vice Chair Tammy Hawkins.
Thanks for being here today. Just a couple of quick questions, and then I'm going to jump back in the queue. Where does GVI and OVP both, since both of y'all are here, get your clients from?
So we have a referral process that includes outside partners like JCPS, DJJ, probation and parole, those types of agencies, as well as some of our nonprofit partner agencies. Ultimately, the decision on whether or not somebody gets a custom notification, attends a call-in, is an internal decision made by GVI, but we get referrals from all of those places.
Okay, so you get referrals. So do those referrals also go by the your employees just going out and saying, hey, I know some, is that considered a referral? Like kind of saying, hey, have you been affected by gun violence? And then does that youth become a client?
Not inherently, no. So in order to become a participant in GVI, you have to have either received a custom notification or attended a call-in if we had done one, right? And so some of the outreach efforts directly to people by partner organizations or something like that may be an attempt to build relationships with people, or maybe somebody identifying someone who may be relevant to our radar, but it's not inherently make somebody a participant until there's that custom notification process.
And that's on GVI, not OVP, correct?
Yes, ma'am.
All right, so OVP, can you answer that, please? Misty?
Yes, Councilwoman. So I want to be clear, GVI is not a services program. So the services organization that these participants are being referred to is the Office of Violence Prevention. So those outreach workers are the ones who are actually servicing those clients and getting them what they need, with the exception of relocation, as Mr. Crawford referred to earlier. So the referrals that are coming into OVP are coming from GVI, they're coming from JCPS, they're coming from, in some instances, parents, they're coming from the CVI sites that Goodwill is running, and they're coming from anyone else who calls and has a concern about someone. The person receiving services has to meet 2 of 7 criteria in order to qualify for services, and they also have to be willing to cease and desist all criminal activity. So that is something, and I'm sorry we missed you last time, Councilwoman, because I think Ashley Webb covered a lot of that at the last time, and I can also get you additional information after this meeting if you'd like.
Right, I looked at that meeting, I don't think she covered any of that. I was told that the employees there, they were told, hey, you can go get you some clients. So if each employee that you have that goes out, and I'm not speaking to the Goodwill Pivot to Peace, I'm speaking directly to OVP employees, go out and say, hey, get you 15 clients. Go find your clients. I just want to make sure that what is the pathway to getting, because it doesn't seem like any of those are high risk. And when I say high risk, I'm meaning high risk getting referrals from the courthouse right across the street, right? Not just an employee, because to me that seems like job security. I'm not going to go out if I have this job, right, and I'm a case manager. I'm not going to go out and get the high risk kids, which doesn't give us solutions, right? I'm going to go out and get the less type of kids that I'm going to have those type of issues from. So if you can follow up, I know you're new in this role, so if you can follow up, and just kind of do some investigating just to see how OVP really gets their clients, okay? So you got plenty of time, just get it to me whenever you can get that information. I know you're also new as well, so I know that GVI does not get their clients from OVP, and if they do, hey, good, I want to say thank you. You're doing a phenomenal job. You're definitely boots on the ground, and I know that you are doing your part. One more question, and then I'm going to get back in the queue, let somebody else. You stated that OVP, GVI had $20,000, correct? That you guys have, and then you work with partners?
So there was a specific line item appropriated to GVI, $20,000 for relocation. In addition to that, we took some of our general fund budget, allocated that additionally to relocation, and then, yes, we work with some partner organizations on relocation as well, or a partner organization on relocation.
Okay, and that would be Joshua Connections, right?
Joshua Community
Which was
Connections, yes, ma'am.
allocated $100,000 in our budget.
Yes, ma'am,
Yeah,
yes.
right, exactly. So what I would like to know is, are those general funds? So can any of our offices contact Joshua Connections and say, hey, we have someone that needs to be relocated? And if so, what is the criteria? I think that there is some there's not a structured criteria. And I was told that GVI, directs if a person can be relocated or not. We need to be able to identify what that relocation looks like. So moving forward, if we can determine if we want to still support that $100,000 that we gave, we definitely want to make sure that the structure and the criterias are the same. And also, I would like to know, I know that transitional services, they transport to Adair County, right? I just want to make sure, is that something that GVI and OVP came together collectively to say that we're only going to relocate out of town? Because one thing that I do know, that majority of us collectively, it's hard to stay sustainable. If you relocate someone out of town, yeah, you can relocate them out of town, but why do they have to go out of town? Right? If they got an issue, they can go to another part of town, because as you know, as the director of GVI, we have a huge gang issue, right? They can just move to another part of town. It's really hard and very expensive to relocate a family and say, well, I'm only relocating a family to this city or to this city, right? And if it's out of city, why does it have to be Chicago, Illinois? Why come it can't be Lexington, Tennessee, Cincinnati, which would be a lot more cheaper, inexpensive to relocate someone? So I just want to know that criteria. So when we're, trying to get someone to get those services, we know directly where to send them to and what that looks like, so it's not all over the place. Because as of right now, it's all over the place, and we just want to make sure that, that they're getting relocated, and that everything's being, transparent on your end and your partners.
Yeah, yes, ma'am. Prior to my coming on, we did not have a written policy for how relocation was done. We have developed that, and I am happy to share with that. It primarily deals with both concerns to the individual and public safety ramifications for that individual staying in Louisville. We primarily, we exclusively locate outside of Jefferson County as a result of concern for the safety for individuals, right? This is still at its core a small town, and if you are at risk in one neighborhood, you are probably at significant risk in another neighborhood. We don't, as a matter of practice, relocate indiscriminately. We do relocate where there is proximity to either family or support networks that individual may either already have or that we have through partners. If there is a functioning goodwill in a jurisdiction where we can have a warm handoff and they'll have access to resources in that jurisdiction, or there's some, again, personal connection, be it family, business, whatever, to a jurisdiction. For the safety of the individuals we have relocated, I don't feel comfortable articulating exactly where we have relocated, but we have relocated within the Commonwealth of Kentucky, just not inside Jefferson County and some distance away.
Right, and I know everywhere where you all have relocated, and just also let me know about the confidentiality piece of it.
Yes, ma'am.
That process as well. Thank you.
Yes, ma'am.
Thank you, Councilwoman. Next in queue would be Councilwoman Parrish Wright, please.
Thank you. I'll keep it to 2 questions and get back in the queue. So as GVI director, are you considered to be under LMPD and your staff is under the mayor's office? I'm just trying to understand who you report to and who your staff reports to. Can you give me that clarity? Are you under LMPD or are you under the mayor's office?
Yes, ma'am, that is, you correctly articulated that. I am embedded within the Criminal Interdiction Division of LMPD, while all other GVI employees report to the mayor's office for data access reasons, as well as information protection, safeties, things like that. That was a necessary split for GVI, but there is still the civilian department.
Okay. And I was glad that I was able to attend the conference held and get some of these updates there. So this is really helpful. I do want to make something clear as we present this data, and so that people understand, when you were speaking about how young people are impacted by violence, you clearly said that more of them are victims than they are perpetrators of violence. And I always want to make sure that we're being clear as we communicate that. You're saying the percentages you gave showed that more young people are actually victims of violence and that they're not the leading perpetrators of all the violence that we're seeing, not just in certain neighborhoods, but all over our county. Is that correct?
We are seeing both, Councilwoman, that juveniles are not the majority of our perpetrators or our victims, statistically speaking. We obviously have better data as it relates to victimization than we do to offending. In order to have data around offending, we obviously have to apprehend the individual who has committed that offense. And so we have better data around victimization than we do offending. We know that juveniles are actively involved in violence in our city. And that we know that there's a significant overlap between victims and offenders. Victimization, especially from a shooting, is one of the primary ways that we identify individuals who will subsequently receive the GVI message. And so for young people, especially in our city, they acutely feel the toll that gun violence takes.
Yeah, and that's why I led with that, because when we're talking to young people who are not even committing violence or feeling like they're blamed for all the violence and things that are happening. So I just think it's important. And thank you for that clarity on how your data is told, because that is the whole question is really about what do you have that is, what are you doing that is restorative and using holistic approaches. I know that there's enforcement and there's policing, but what is happening on that end? Because you have advocates who are out here trying to help stop violence, mitigate violence, and deal with it. But what are we offering through your work that is holistic, restorative, so that it also tells the other part of the data that these families need resources. And I'm glad to hear about the relocation, but there's other things that are needed. Just wanted to hear about that.
Yes, ma'am. Through our partnership with OVP, we have access to the full suite of services that OVP offers. But in hopefully in renewed and expanded partnerships with Goodwill. We now have access to a big portion of what Goodwill offers in terms of services, especially employment-related services, job trainings, things of that nature. And again, we're in the very early stages of hopefully forming a partnership with the Department of Public Health to expand access to behavioral health resources to some of these individuals. For the populations that we're talking about, the interventions that work on the population more broadly don't necessarily have the same success rates that they do with kids with this level of risks and needs. But one of the things that does, and does time and time again in the evaluations, are things like cognitive behavioral therapy. And so getting access to especially young people, juveniles and young adults, to those kinds of resources, I think is going to be critical to the service side of the house of what we do.
Thank you, Councilwoman. Next in queue would be Councilman Piagentini, and before, I'd like to recognize Marilyn Parker, Councilwoman Marilyn Parker, who's joined us. But Councilman Piagentini, you have the floor, please.
Thank you, Mr. Chair. First of all, Mr. Crawford, great to see you. Glad you're in this role. I was going to ask a question about the relocation thing, but some have been asked. If you could send that information to me, I'm very interested in how we're doing it and what the success factors look like and all of that. I think it's a great tool in the tool chest for in certain cases. So I'd like to hear more about that. We can do that offline.
Yes, sir.
My question is about your relationship and your office's relationship with LMPD, particularly surrounding those folks who do not engage in the process or reoffend, right? Obviously, if they engage in the process, get access to services, get out of the life, right? Get jobs, go do their thing. That's the greatest success we could hope for. If they don't, how does that process with LMPD work? Because in my reading of all the literature on this and how this is supposed to work is kind of for those that reject it and keep engaging in the group violence life, that it's sort of like we need to bring every aspect of law enforcement to enforce the law at that point. So how does that work with your office?
Yeah, there are really two paths forward once somebody has received a custom notification, or I guess you could say three. One path is that an individual desists from shootings but doesn't uptake the services, right? They just choose to continue a lifestyle that is generally antisocial, but they don't perpetuate the violence anymore. That's one path. The second path is that an individual chooses the uptake of some service or some set of services. Obviously, that's the hope in most instances. But of course, there are the individuals who not only don't uptake those services, but continue to be involved in gun violence in the city. For those individuals, the men and women that I get the pleasure of working with every day in LMPD, specifically within CID and LMPD, the full weight of law enforcement is what awaits them. And obviously can't disclose details about anything in particular, but that includes everything from longer investigations with the goal of dismantling a criminal enterprise to shorter-term solutions like going after individuals who are on some form of supervision, doing things they shouldn't be doing, and giving that individual some additional attention should they continue to perpetuate gun violence in the city.
Great. Thank you very much. Thank you, Mr. Chairman.
Thank you, Councilman. Councilman Joseph, please, you're in the queue.
Yeah, I'll be quick. Can you just tell me just a couple like bullet points, talking points of how you would say if someone were to ask you, what does OVP do? How would you just answer that? And then also, what do you also do besides the weekly talks with participants?
So I'll give Ms. Wright the opportunity to answer as it relates to OVP because I don't work for OVP.
And just to be clear, Councilman, are you asking about OVP or GVI?
OVP.
Okay. So this, I would defer to the OVP director and deputy director as they testified last time on the plethora of things that they do, but the general categories of what they do would include CVI, so that's the attempt to get people out of the life that could include gun violence, that puts people at risk of gun violence. So they do case management and outreach for those individuals and try to do everything they can to give those individuals services and wraparound services for that family. So one is that. Two is youth and community engagement. So they prop up anti-violence coalitions in different neighborhoods and try to bring community together to come up with community-focused solutions in what they're doing. And they also do other things like Community Sanctuary Project, where if a community is hurting, someone will go out with our faith-based leaders to have a gathering for that community, bring them together, provide food, provide mental health support, and do what they can to support communities. So one is CBI, Pivot to Peace. Two is the youth and community engagement. And then the third part would be management of grants with outside partners. So through things like the Get Busy initiative, which is the mayor's initiative providing activities to our middle school aged youth in 3 underserved neighborhoods, they're managing that grant and having that move forward. They have managed the majority of the ARP funded grants. They continue to manage grants with partners throughout the city. So those are the 3 main functions for OVP.
Okay, thank you.
Thank you, Councilman. I hate to do this because I know people have more questions, but we're going to have to go to a hard stop because we've got another half hour. But I appreciate you all for coming in and giving the information. If there are any other questions, feel free to write the group, and I'm sure they'll answer. But thank you so much for coming.
Thank you, Councilman.
Clerk, please read item number 2 in the record.
An ordinance repealing the Louisville Metro Code of Ordinances, LMCO, sections 115.170 to 115.182, and replacing them with sections 115.172, 115.196 regarding massage facilities, read in full.
I've been properly moved. We have Connie Mendel with Metro Department of Public Health and Wellness, Brad Silveria with Metro ABC, Dan Marsden with LMPD, available for questions, Director Richard Price and Assistant Director Philip Crow with Codes and Regulations are here also. Councilman Hudson is the one that's brought this bill, and we're giving you the floor now.
Thank you, Mr. Chair. The ordinance that is before us did not come in lightly. This was put together from a team of over 40 people working over a year to get us where we are today, and I want to thank that team. We have representatives from law enforcement at the local, state, and federal level, the health department, the mayor's office, industry representatives, lots of diverse opinions on this thing, and we struggled with a lot of the language that's in there, but it was a good fight to have. Fight's probably not the right word. It's a good struggle to have. But I think that the legislation that we have before us today is a good piece of legislation. But why is it important? Illicit, illegal massage facilities are being used for human trafficking in this city. There is not a single metro district in this room that is not affected by this. There are these facilities in every single district. And on the flip side, the illegitimate businesses are disparaging the legitimate businesses and the honorable profession of massage therapy. There's been a lot of discussion around why don't you just work with the state? The state already licenses massage therapists, and that's true. The state licenses the people. What this ordinance does is license the facility. And it's nothing new. We, Louisville, have had an ordinance on the books since 1974 that issues licenses to massage facilities. 15 years ago, a decision was made to stop issuing those licenses. Over the course of those 15 years, our computer systems have changed at least 3 times to the point where we no longer had the capability to issue a license. It just wasn't on the drop down. So we've corrected that. the fee for a license originally set in 1974 was $100. It's $200 now, but that $100 or $200 also includes the fee for the first inspection, which was a separate fee back in 1974, so it's almost a wash that way. But again, this work was not done in a vacuum. We were given input from almost every facet and element that is attached to this issue. And I'll be glad to answer any questions that people have, but I'll return the floor to the chair and be glad to answer any questions.
Thank you, Councilman. We do have a couple people in the queue. Vice Chair Hawkins, you have the floor.
First, I want to say, thank you, Councilman Hudson. I know that you've, followed up with a few people that has contacted my office. I want to say thank you for that. Just a quick question. So this is for the bad actors, pretty much. Is it okay if I ask? Yeah. This is pretty much for the bad actors, correct? I just want to, make sure that we send a message to all the good actors that we're not targeting their businesses. We want, we know how hard it is to, it's easy to open, but it's harder to stay open. And in good faith, I just want, to you to speak on just a little bit about, about that.
One of the things I love about you, Councilwoman Hawkins, is you're real. And that is exactly the point here, is to go after the bad actors. The horror of the human trafficking that is going on in these places, the illegitimate places. And I can't make that distinction more clearly, that we are going after the illegitimate, illegal operations. Rules are not written for the people that are following the rules. And that's what this is. This is going after the bad actors. Thank you for that question.
Thank you, Councilman Hudson. We have Councilwoman Parrish Wright, please.
Thank you, Mr. Chair, and thank you, Mr. Hudson. Councilwoman Hawkins covered a lot of my concerns, as the people who are reaching out, though, are also people who are licensed massage therapists and who are saying that this will cause issues. They've asked for it to be tabled, and I just want to confirm that I know you said it's a well-rounded discussion. I know it's not new. I know most of the things you do are seem to be very measured. I'm not doubting that, and I know sometimes going after the bad actors, sometimes it makes it harder for people who are doing the right thing and doing what they say. I do think it's interesting, especially with the county attorney, as we try to bring up issues around what the state has control over and what we have to, and it seems like there's a pick and choose on what we choose to intervene in when it comes to the state level. And I just really would love this energy to be used for other issues that have some state oversight or state connections, and that how hard it is to navigate that when you bring something. They say, oh, well, the state does that, because a great deal of people feel like everything is already covered with the state, that most of these bad actors aren't checking in with the state or checking their license status before they do the things that we know that are happening. And I do believe that those things should be regulated. I just want to say, out of the massage therapists that I hope that you've been in conversation with, what has been the biggest feedback from them, so that I can make sure that we're making the best informed decisions that include a lot of small business owners who operate in this way, the good actors.
Can I respond?
You'd like to respond?
So thank you for your kind words, and thank you for the question. In a Pareto of complaints or concerns or questions that I have received, by far the number one is, why don't you work with the state? Let me show you what that looks like. October 24th of last year, after we had tried to work locally and find out the landscape, We did call the state, the Kentucky Board of Massage Therapists, and we were told, thank you for calling, and we will take that under advisement and get back to you. That was on October 24th of last year. November 11th of last year, having not heard anything, I called the Attorney General. We were told the same thing, we'll get back to you. No response yet on that one. December 19th of last year, I called the Kentucky Board of Massage Therapists again to follow up. I hadn't heard from you since October 24th, and we were told that our case would be forwarded to the complaint subcommittee, is what it was called. Still waiting for a response from that. So that's what it looks like to work with the state on this issue. So it's not that we haven't tried to work with the state, but the state wasn't interested in this until Monday when this ordinance was filed. So I don't know what, and the other distinction here, again, is the state issues licenses for the people. This ordinance only addresses the facility. Two completely different issues. But thank you for the question.
Thank you, Councilman. Next in queue would be Councilwoman Marilyn Parker, please.
Thank you, Mr. Chair. And I just want to say kudos to Councilman Hudson, who spent a year of work on this and was gracious enough to ask me to be a co-sponsor, which I am. And unfortunately, another reason I am is because I have come to find out a lot of these type facilities in my district. So we need to take care of it. And with all that being said, just for clarification purposes, I want to ask a couple questions so that info can maybe be cleared up a little bit. And one of them has to do with the registry. So, Councilman Hudson, can you clarify for the public how the registry record should be kept? Is it simply a sign and log? Is there details, or is it just normal business practices?
So there's 4 pieces of information that will be held in that registry. The name of the patron, the name of the therapist, the date and time of the service, and services rendered. That'll be held either electronically or pen and paper. I would defer to either the health department or ABC to give the nuts and bolts on exactly how that is kept, how those records are kept. But I don't know if maybe I've answered your question. If I haven't, I would defer to ABC and health department.
Connie Mendel, Louisville Metro Public Health and Wellness, excuse me, Chief Health Strategist. Businesses, we're not in the business of mandating how you keep records, whether it's a computer or a log. I will say that legitimate businesses have very detailed records, particularly if anyone has visited a legitimate business. When you first come in, they're going to ask you about what medical problems you have, where are your tension areas. I mean, it is a detailed, because they don't want to harm you. They're a legitimate massage therapist job is to relieve stress and relieve, help with medical conditions. So anyone that's visited those, they will probably have a file on each of their clients.
So to clarify that, there's really no extra work involved in that. Okay, that's great. Got that covered. And will the therapists be subject to 2 inspections a year? I know you said 1, but is it 2?
It's 2 per year.
2, okay.
Like other facilities, so just as note, the health department currently regulates other type of facilities. I think most of you are aware of food facilities that we regulate, daycares, hospitals, but we also regulate tanning beds, Tattoo studios and also required a certified artist. Piercing studios also requires a certified artist. Swimming pools, which require certified pool operators. Septic installers, again, there's a certification required for that. So these are things that the health department already regulates.
Okay, and there's no extra fee for the second inspection?
No, it lists a minimum of 2 inspections a year, but there could also be complaint-based inspections. And we do a couple thousand of those a year throughout all of those type of facilities that I listed.
Okay, thank
And
you.
we encourage the public to refer to us establishments that they think are illegitimate.
Got my 2 in.
Councilwoman Betsy Ruby, please.
Thank you very much. First of all, Councilman Hudson, thank you for your work on this. I know this is a big, complicated document, and there's a lot of rules and regulations that need to be met, but I have some very specific concerns with it. Having used physical therapists over the years, I have used one physical therapist who came to my home, brought her own table, gave me a massage in my living room. According to your ordinance, the way it is written now, that will be illegal.
Can
Go
I
ahead.
respond to that one?
Please.
That's incorrect.
Okay.
That particular case is exempt. If you look on the last page, those exact words are the home served. Yeah. Section 115.196, subsection C, licensed massage therapists who are not operating a massage facility. So if they come to your home, or Part A talks about physical therapists. Those are exempt from this entire chapter.
Okay, thank you for that. So I've also worked with a physical therapist who operates a studio out of her home. My understanding from reading this is that that will be illegal. Is that also correct, incorrect?
Yeah, that was the Part C. That is exempt from this chapter.
That is exempt, okay. And then one that was left out of this discussion, at least by the reading of the massage therapist that I spoke with, he operates a studio where, much like a beauty salon, rents a chair. And so these are not his employees, they are independent contractors who work in his studio. How are they covered under this? Because he could not figure out how that fits.
Again, the state licenses the people. This only addresses the facility.
Well, how does this facility fit under that then?
If you have licensed massage therapists working in your building, then that facility needs to be licensed. Am I right about that? Yeah.
And each
Okay.
therapist must have their individual state massage therapy licenses.
Okay, what about also an incident, he also mentioned that he has a young person who's been seeing him since he was 5 years old. And he's now a teenager, and he walks to the facility on his own. There's no reason to have an adult there. He's been doing this for years. But according to the current writing of this, it's required that he has an adult with him.
Yeah, minimum 18 years old to enter the facility unaccompanied.
Is it possible to add something in there that, with authorization from the parent, the child's allowed to come on their own?
Yeah, I'd be open to that.
Because it's an ongoing discussion. Okay, I have other questions, but I would like to cede this and give someone else a chance to talk.
Thank you, Councilwoman. Next in queue would be Councilwoman Mulvey Woolridge, please.
Thank you. And first of all, thank you, Councilman Hudson, for all the work that you've put into this. I know we've had lots of discussions on it. I do support this. I know we had conversation, and I would like to be added as a co-sponsor to this as well. I know that it's been over a year. You've worked with many task force organizations, deputy mayor, et cetera, on this. I know some of my questions have been addressed. I have been reached out to, as I'm sure many of our council people here, phone calls, emails, from many of those, not only our constituents, but those across the city. I think the only one that I just want documented of being asked is about locking the doors. As we know, a lot of the facilities may have minimal reception, may have minimal massage therapists in there, but asking about locking the doors, I would assume, even though I don't want to assume, it's for fire hazards, right? Making sure that we're up to code on fire regulations, making sure that the doors and all entrances and everything are kept open at all times, that the facility is open, but can you confirm that?
Yeah, I'm going to defer to either Health Department or ABC to answer that one.
I think this is section 115.177 in one of the emails that I got. And it's about access to the facility. So it's 115.177.
I know there's an exception for exterior doors, obviously, to be locked, particularly as someone that's working in an independent facility. I think this relates to interior doors.
Yeah, it says 15177, so it's about the access. All front reception, hallway, exterior, or main entry doors shall be unlocked during business hours, except as may be permitted and applicable by law, i.e. fire codes. I think the concern is coming in that there's minimal people in and worried if they're giving a massage that others from the streets may come in.
Yeah, I think if you look further into that section, it says it shall not apply to exterior doors that are used solely by the owners or the employees of the massage facility. Shall not apply to a massage facility that if the massage facility is a business entity owned and operated by one individual. So there are several exceptions there. And again, this is to target the bad actors, not go after the people that are legitimate businesses. But
I would have to defer this over to the county attorney with the writing. I don't remember in any of our discussions locking down that during your private massage, that door couldn't be locked, but I would defer that. Sorry, I'm Brad Severia, for anybody who doesn't know me. Like Councilman Hudson said, the intent is to root out human trafficking and the people that are performing services commensurate with that. And, that's why we're really going after this.
Understood. And like I said, I completely agree with it, and I wanted to be added as a co-sponsor, so I just want to make sure it's documented for those that did have concerns, want to make sure it's being addressed and getting their answers. But I appreciate it. Thank you. And again, thank you for the work.
Thank you.
Thank you. Next in queue is Marcus Winkler, please.
Thank you, Mr. Chair. I have maybe just one question for the sponsor and a suggested amendment. So let me just first say, completely agree with the intent of this ordinance. Nobody wants human trafficking. In fact, happened totally unrelated to this, was visiting the Center for Women and Families last week and sort of asked about this, is this a real concern? And they said, absolutely, this is a real concern in our community, so applaud you for your efforts. The concern I have is I got an email yesterday from a constituent who highlighted that they have prescription for massages, specifically including their glutes, pecs, and breasts, okay? Mm-hmm. And so the concern is that given the definitions of genitalia and then section 115.184 E, the last sentence, any contact with the patient's sexual or genitalia is strictly prohibited. I think that's problematic if they've got a prescription. And so I'm wondering if we might be amenable to a friendly amendment that adds something in addition there to, like, unless ordered by a medical doctor, or, I was speaking to my colleague to my left, and we said prescription, but it might not be written as a script per se, so we don't want to be overly prescriptive for using the same word twice, but unless, under medical orders or recommended by a physician or something to that order. And Connie, maybe I'll defer to you if you have a recommendation on sort of how to word that, but it would just be the addition of sort of those 3 or 4 words after that it's strictly prohibited.
So to answer your first questions, I would certainly be open, but I would refer you to page 3 where it talks about intentional touching either directly through the clothing of the genitalia. I'm not going to go through all of these descriptions on the record here, but the last sentence talks about with an intent to arouse or gratify the sexual desire of any person. So it's all about the intent of the touching.
So totally understand. I do think then, though, that 115 to an extent is contrary, because it says it is strictly prohibited,
Yep.
right? And without that additional clarification, so.
Certainly open.
I know that's your point, right? I think if somebody has a prescription for, their glutes to be massaged or their
Yep.
breasts to be massaged, and there's a medical reason for that, we wouldn't have any issue with that. I mean, the point here clearly is if
Yep.
it's for sexual gratification.
Certainly open to that discussion.
So I'm not on the committee. I can't make that amendment. I would ask if somebody could make an amendment that adds some sort of clarification there. Okay. Thank you, Mr. Chair.
Can we go next? Thank you.
Okay, I move to make an amendment, adding a clarification on that.
Second.
Are we ready? Councilman Piagentini?
Thank you, Mr. Chair. Okay. Let me begin by making an amendment here to section 115.184, letter E. It'll read as follows. Just give me a quick second. The sexual and genital areas of a patron must be covered by a full opaque covering of the patient, the presence of massage therapist or employee. Any contact with the patron's sexual or genital areas is strictly prohibited unless under direct orders of a licensed medical professional. And I would like to make that in the form of amendment.
We have a motion?
That's
I move.
Second.
Okay, the amendment's been properly moved. A voice vote?
Well, any debate on the amendment? I
We're going
mean,
to debate on the amendment? So we need a voice vote. All in favor, say aye.
Aye.
Opposed? Been properly moved. Mr. Piagentini, did you have any more that you wanted to?
Yeah, I'll just make this quick. I know my colleague, with all good intention, mentioned minors being able to enter some of these places unaccompanied. I would not be in favor of that. This is a therapeutic service, one that is done in many cases and when done legitimately, is done for the purposes of health and health care. Minors cannot go into healthcare facilities unaccompanied. So I think, to be consistent, that is something that we should not condone here. And the door that would be opened to have minors going in an unaccompanied way into these facilities is too broad a door to allow the bad actors to continue operating. So I just wanted to voice my concern with that. I know that was mentioned earlier. Other than that, thank you, Connie, for making your comments earlier. I appreciate your support as well as the other elements of the administration, ABC, codes and regs. I can't think, frankly, of something that we voted on recently that's this important. This is in every way sexual slavery. This is and because 15 years ago, some prior administration decided to stop enforcing the law, we have seen an absolute explosion of this activity in this city. At this point, I don't care what the state does. I don't care what our bordering counties do. We must send a clear signal to this industry, if you want to call it that, to this criminal behavior, that this is not acceptable in Jefferson County. Again, I am a person that, I would love to not have to do any regulation, and if we're all angels, we wouldn't. But this is one of those areas where the public health concerns significantly outweigh again, we're not changing anything to individuals in their licensure process, only to the businesses. It is completely standard that businesses have to go through some minor process, which is what I would call this, in order to license themselves, particularly when you're talking about healthcare. This is nothing, coming from somebody who's been in the healthcare sector his whole life, this is nothing compared to the regulations and processes and licensure that healthcare facilities have to go through before they can start serving people. So I can't tell you enough. Councilman Hudson's been briefing my caucus for quite some time now on his progress on this. I'm so happy to see this come to fruition, and I'm just going to encourage everybody to support the passage of this as soon as possible. Thank you, Mr. Chair.
Thank you, Councilman. Councilman Joseph, please.
Councilman Hudson, thank you for your work on this. I would like to be added as a sponsor, and then I would also like to call the question.
Is there a move? Is there a second? Did you just second? The motion has been moved, so we will call the question. Huh? We do have to take a vote? Oh, we have to make a vote to move it. So we need to vote whether we're going to call the question. All in favor say aye. Opposed? The ayes have it, or do you want to roll call? Roll call.
Vote is open. Committee Member Parrish Wright?
Yes.
Chair, you have 6 yes, 2 no, and 1 present vote.
So the yes has it, and we will vote on the measure. Is this an ordinance, right? So we, roll call.
Voting's open. Committee Member Parrish Wright?
Present.
I know that this is tied to this. Do you want to take them?
You don't have time to call it, so you just can hold it and just.
Yeah.
Committee Member Shanklin?
Hold on 1 second.
Okay, thank you. Chair, you have 6 yes and 3 present votes.
The legislation passes. We'll send it to old business. It was amended, yeah, so it does go to old business. Okay. We're past time, so we're going to have to move some legislation to our next meeting. And to be fair, Councilman Leninger has a measure that he wants to discuss, and I want to give him time to do so. We're going to cancel the next meeting because a lot of us are going to be out of town, but we're going to have the next meeting the following Monday, and Councilman Leninger, we're going to give you that time to speak, and we're also going to have to move this other ordinance from Mr. Hudson to that day, if it's okay. In the meantime, there are no more speakers.
Mr. Chair, can I just ask a question? Just to clarify, you are telling us on the record that you are canceling the meeting on the 19th?
I'm getting ready to mention that.
Okay, very good, and the reschedule, okay.
Yes. Our next committee meeting for Wednesday, November 19th is canceled. Instead, we'll have a special Public Safety Committee on Monday, December 1st at 4 p.m. If there are no other matters, this committee stands adjourned.